right, listeners, I've got Dr. Ryan on the line. He's taken some time out of his a very busy schedule to keep us informed of what's going on. Good morning, Dr. Ryan.
Good morning, Mark. Welcome back.
Well, thank you so much, and I'm glad to be back. But gee whiz, I thought that when I came back, we might have an opportunity to speak to some of the other pressing health issues in Clear Creek County. I guess they're going to have to wait for a little bit longer. We still don't have control of the virus, and I guess we might as well start with a review of the local statistics, if you would, please.
Absolutely. So right now, we have had 8 cases in the last week, although as stated on the BOCC call, that is an underestimate given a number of things. We've had 13 in the last 2 weeks and 496 to date. Those case counts over the last week and 2 weeks are almost a tripling of what we've seen over the last 2 months on a weekly basis. Hospitalizations at 25, 3 fatalities. Our 2-week cumulative incident rate has jumped from what it was last week to 133 per 100,000. And our 2-week positivity rate has more than doubled in the last several weeks as well. This is driven all by the Delta variant, which is now 90+% of cases in Colorado. It is the far more transmissible, in the far more, in terms of symptoms, problematic for individuals in terms of the severity of their illness. And so right now it is predominantly in the unvaccinated that are being affected by this. We have had some breakthrough cases, meaning individuals who are fully vaccinated. There's a huge difference, though, between the vaccinated and unvaccinated as far as their cases are concerned. The vaccinated, it is a case of several days of mild cold-like symptoms. For the unvaccinated, it is a far different story. It isn't days, it's weeks of severe symptoms that individuals are experiencing. And so all the more reason to get vaccinated as soon as you possibly can.
Dr. Ryan, if the case count continues to increase, what are the implications for health orders?
And meaning in terms the statewide, I don't know. That's not my wheelhouse. Local public health orders, we are taking steps already. For instance, last week the county has mandated that all unvaccinated employees need to wear masks while at work. That is something new, and we were the first county in this state to implement that, primarily because we saw the writing on the wall and what was coming our way. Similarly, in the school district, the plan this year is to implement many of the same protocol that we had last year, even though we have 75% roughly of our staff who are fully vaccinated. We only have 35% or so of the student body who's vaccinated in the middle school, high school. But even given those numbers, we are mandating mask wearing through K through 12th grade, regardless of vaccination status among the students. We believe that is the best course of action for the student body. It's meant to protect everybody. The last thing we want is an outbreak in school. The stated goal of the school district is to have kids in school every day of the school year. Now, in order to do that, we need to keep them as healthy as possible and avoid outbreaks. My goal as public health director is keep those kids as safe and healthy as humanly possible. And I'm going to make it so that, that happens. And through the protocol that we have put in place a couple weeks ago, we're going to be able to do that. And strangely enough, the CDC just changed their guidance this morning, and it is now in line with the guidance that we and the protocols that we have put in place and decided on weeks ago. So they must have read our protocol updates and changed their mind moving forward with a little humor in there.
Well, there's nothing wrong with being in a leadership position. I wonder if there are other businesses that you feel within the community, businesses that are where there is a particular risk of spread.
I would say that the greatest risk lies in the restaurants, primarily because everyone who's in there is unmasked, right? They're in there eating. And so it's the largest volume of people in our county in any one space on any given day. It's also the greatest number of individuals in that space who are unmasked, and not only unmasked, but unmasked for a duration of time, meaning it isn't just you pass somebody in a store or a shop. It's you're sitting next to somebody who's 5 feet away for the better part of an hour while you're eating and they're eating. So the level and risk of exposure is probably greatest in that scenario, one, given duration, and two, given the sheer volume of people that are in there, is the greatest potential risk in our community. And so I would take precautions. If you're unvaccinated, I would really limit your dining in experience. I would certainly patronize the restaurants in takeout form, but I would do yourself a favor. If you are unvaccinated, I would not run the risk of going in and sitting in restaurants. It's putting yourself at tremendous risk. More importantly, it's putting people around you at risk. First and foremost, I would encourage you to get vaccinated. It is our only way out of this. There is no other course of action that we as a country can take that is going to end this pandemic for us than to get our vaccination rate up to where it needs to be. And where we're at now is woefully under where we need to be.
To speak to that exact question, when I left in the middle of June, the mask orders had been lifted, and we were trending in a very positive direction, and there were people were still being vaccinated at a substantial rate. But and maybe my memory is faulty, but I think I remember that the over 65 percentage of Clear Creek County residents that were vaccinated was 68% when I left, and by golly, it's 68% right now. Now the overall rate has increased from the high 40s to the low 60s, and that's terrific. But I just don't understand how older folks have stalled so completely.
Mark, it's a great question, and there's probably as many answers as there are people who are unvaccinated, right? For some, as stated earlier, it's a mistrust of, quote-unquote, the government, whatever that means. For others, it's a natural hesitancy to get vaccines. They have historically been that way. For others, it is a matter of I haven't gotten around to it, or it doesn't appear to me to pose great risk to me. And so I haven't gotten around to it yet, right? So all of those reasons and rationale we're having to deal with, and we're having to figure out ways to sort of break through, right? The hesitancy. As I speak about the safety and efficacy of the vaccines, they've been given to hundreds of millions of people, not only in this country, but hundreds and billions of people across the world. And the safety and efficacy of them speaks for itself. In terms of, other reasons and rationale people have, we're trying to understand them as best as we can, and we're trying to provide the education and information out there, the facts, if you will. Because as we've talked about many times, there's so much misinformation out there, and it's fueling people's hesitancies or skepticism or whatever you want to call it, and it's sort of reinforcing it. And so it's really trying to break through that misinformation. The problem is, historically, we've never seen the levels of misinformation that we have today. Social media and all of those avenues have provided opportunity to backfill with massive amounts of misinformation. Anecdotally, we try to ask people as they come in, why are you here now, as opposed to 6 months ago or 2 months ago or even 2 weeks ago, and really trying to understand and appreciate their reason, right? Everyone has their reason, and they're entitled to that. It's not a matter of judgment. We're merely trying to understand so that we can better do our jobs of educating and informing people with facts, and trying to overcome that mountain of misinformation. But public health has never seen the likes of this level of misinformation at any point in human history, and so it's requiring us to work even harder. Even though we don't have any more hours in the day, and I don't have any more staff than I did 6 months ago. So it's just our reality.
I will just say, again, anecdotally, that I have heard a number of people make physiological arguments against vaccination. Either herd immunity is coming, or I had the COVID, and so I'm immune, therefore I'm immune. And I wonder if you'd speak to some of those concerns or arguments.
Oh, absolutely. And so, as I said just a few minutes ago on the BOCC call, what we're facing now in the middle of a global pandemic, because that's what it is, there is no I. There is us and we. And so herd immunity isn't coming. It's coming only when the masses get vaccinated, and that starts with you, the individual. Need to get vaccinated. It's the only thing that gets us to herd immunity. There is a percentage of our population that can't get vaccinated for a whole host of real medical reasons. They cannot get vaccinated, and it is incumbent upon the rest of us to help protect them because they can't get protected themselves. We're a long way from that. We're only at less than 50% of the country is vaccinated. We need to be well above that, well above 75%. And some say, well, that number keeps changing. Why is that? It has every single thing to do with the virus. The level of immunity that is needed in the community is highly and completely dependent on the virus that we're trying to protect against. The more virulent and the more transmissible and the more deadly it is, the higher the level of herd immunity that is required in the community. So when this whole conversation started, and Dr. Fauci said, right now our estimate is somewhere between 70 and 80%. Remember those days? Right. That was based on the information they had at the time. And as we get more and more information and we see what variants are developing, that number very well may change and may go up slightly. That's reality, and that isn't new to COVID. That's true for every other virus that we have vaccines for and tried to protect the broader community. As far as a prior diagnosis, what we do know as a fact is that a prior diagnosis, whether it be 2 months ago or 14 months ago, your level of immunity and protection against what is now a very different virus in the Delta form is not nearly as protective as any one of the vaccines that we have available in this country, which are currently 3. We're the only country on planet Earth that has an abundance of 3 different vaccines that are plentifully available to anyone and everyone who wants one. So if you've had a prior diagnosis, I would strongly recommend to you, as I would a completely unvaccinated and person who's never had COVID, to get a vaccine shot as quickly as you can. The mRNA vaccines, the Pfizer and the Moderna, provide you a level, an umbrella of protection, the likes of which a prior diagnosis does not. So I would strongly encourage you, even if you had COVID and your symptoms were mild or you got over it in 2 weeks or whatever, I would strongly, as highly strongly as I possibly can, to get vaccinated as quickly as you can. People are getting reinfected even though they've had a prior diagnosis, and the second time around is nothing like the first time around.
Let's talk about the mRNA for a moment. There's a couple of things here. First, the history of it. I hear people say, oh, it's so brand new, nobody has any idea what the implications of that technology might be long term. And then the other thing that I hear is that it's an emergency use authorization, and they're waiting for the permanent authorization to come out of the FDA.
Okay, let me take those one at a time. As far as the mRNA technology, it is not new. mRNA technology has been around for a couple decades. It has been tested. It has been tested in the laboratory, in petri dishes, in animals of all sorts, and in human beings. This is true, this is the first time that it is being used in a vaccine more broadly in the population. That's a fact. The technology isn't new. The technology has been proven safe and effective for many, many years. The emergency use authorization question, that's more of an administrative and procedural reality than it is a reason or justification for you not getting vaccinated as quickly as possible. To my point earlier, hundreds of millions of people around the world have received the vaccine and are 7 months into or more, if you include the folks in the clinical trial, of history of showing that, in fact, there are no long-term side effects. There are no immediate side effects. There are no safety or efficacy issues identified to date. I think, and I stated this earlier on the commissioner's call, the fact that the FDA paused the use of the J&J vaccine because there were 6 cases of a potential clotting issue speaks to the level of seriousness and professionalism that they take in making sure that these vaccines are safe and effective. Right? That is, hundreds of millions of dollars was paused because 6 people had a potentially life-threatening event, and they took it incredibly seriously. They will continue to do that. That hasn't changed. So whether it's labeled emergency use or full use, which is coming in the next several months, I would not wait. That administrative label will not save your life. What will save your life is the vaccine in your arm. Don't wait for an administrative label on a product that has been in hundreds of millions of people around the world, billion people for that matter, around the world, that has shown to be safe and effective. This is a completely preventable disease, and it is now in your court, as they say, and make that decision and go get a vaccine as quickly as you can. You do not want COVID.
To that point, I remember when last fall, when the applications went to the FDA from Moderna and Pfizer for the emergency use of their vaccines, and I remember hearing that it was 100 or more pages of statistical documentation of the efficacy and safety of vaccines, and those were peer-reviewed by the top brains in every university and every setting across the country and in fact the world before that emergency use was even authorized. I mean that sounded good enough to me.
Absolutely, it isn't no shortcuts were made, right? The clinical trials, and this is my point again earlier. People say, "Oh, I don't trust the government." The government has nothing to do with this. Scientists, the best in the country and some of the best in the world, are the ones reviewing and looking at this data. Not the federal government, not the state government, and certainly not the local government. It is the top virologists and immunologists and epidemiologists and statisticians who are combing over this data and looking at it with a fine-tooth comb with the 2 basic questions in mind. Is it safe and is it effective? And those questions were answered unequivocally in all the vaccines that we have in the multiple times that they looked at that data, right? When they say the FDA approved it, the people on the FDA advisory committee who don't actually work for the FDA are all of those really smart people who are the top in their field across the entire country and the world. Those are the folks who are looking out for you. The federal government is the ones who merely give it that administrative label of saying, our external advisory board agreed, it is safe and effective, and furthermore, they have similar smart people at the FDA, don't get me wrong, in the CDC. And they, too, look at the data and say, we completely agree with our external advisory committee, and we're going to give it an administrative label in saying it's emergency use authorization for now, and then in a few months or 6 months, whatever it takes them to do the administrative part of it, we're going to give it full authorization. There is no benefit to you as a citizen in waiting, not a one. There is nothing but tremendous risk to wait for what is nothing more than an administrative label.
Now, I know from reading in newspapers and listening to different things that there are subgroups of folks that have had that have had a high degree of hesitancy toward the vaccine for a variety of social reasons. And we had a caller just a moment before you called in, Dr. Ryan, who wanted to ask you directly about undocumented folks here in the country who are hesitant to become vaccinated. And I guess the question is, she asked directly, how can they do that without being reported? But I guess the real question might be, are those people reported? Is there any process for separating the undocumented person from the citizen?
Absolutely not. We do not ask for any form of proof that you are a U.S. citizen when we vaccinate you, whether you were born and raised here or just got here. It matters not to us. Our primary objective as public health is to protect you, no matter where you're from or where you might be going. So we don't and are not a part of any process that would identify those individuals and or report them. That is not our wheelhouse. Our wheelhouse is to protect them, regardless of where they're from. We don't ask, we vaccinate. We vaccinate those who are unvaccinated and are in need of that service. That's what we do and we provide. So people should not feel threatened in any way, shape, or form of coming in to get vaccinated. If you are unvaccinated, regardless of your civic status, please come in and get vaccinated. It will not impact in any way, shape, or form your status now or in the future. Completely separate from that reality. We are there to protect you from a health perspective, and that's our only goal.
Okay, one more question about the vaccines. I just would like to give you a chance to reiterate the availability of these free vaccines, and let's tell folks where they can go and when they can go to become vaccinated for free.
Absolutely. So Clear Creek County Public Health has vaccine clinics every Wednesday from 10 a.m. to 2 p.m. At the Resource Center in Idaho Springs. Although I will add a caveat to that, we are moving to our new building, hopefully in the next 2 weeks. So obviously the clinic will move from the Resource Center to the new Collaborative Care Center in the coming weeks. I'm not sure of the date yet. I've been told the date, but I don't know that it's real until it's happening. But every Wednesday we are providing free vaccines from 10 a.m. to 2 p.m. In addition, folks can call our COVID vaccine information line, where we will have all of this information. And that number is, I will repeat this twice, 303-670-7528. Again, that's 303-670-7528. And it's an information line, and so we'll provide you information, obviously. In addition to the services and vaccines we're providing, the Safeway in Idaho Springs has vaccines available. They're administering the Pfizer vaccine. Also, the Walmart in Evergreen, which you can take the Prospector bus all the way there if you so choose. They are also no appointment necessary at any of these locations at this point. The Walmart pharmacy in Evergreen is administering vaccines, as is the Safeway and King Soopers in Evergreen, as is the Evergreen Fire Department. So there are a number of locations literally within 10, 15 miles of anyone in the county to get a vaccine if and when they are ready. I would highly encourage you to not wait. As I said on the call now, the vast majority of our cases are in unvaccinated. 98% plus are in the unvaccinated. And if I were to use one word to sum up their perspective, it's remorse. Remorse that they didn't get the vaccine sooner, that they waited so long, and now they're having to deal with COVID. COVID is something you don't want. Do some people have mild symptoms? Absolutely. But you have no idea how your body is going to react. And again, even if you had it once, it doesn't guarantee you the second time isn't going to be a totally different thing. because this is a different virus now. The Delta variant is far different, more different than the original virus, and I think it's important for people to realize that. So plenty of vaccines available, plenty of opportunity to get it. If you do know anyone that is unable to get to those locations, please call us and let us know. We've given out dozens of vaccines, several dozen vaccines in people's homes for those folks who can't get out and are not mobile. So please reach out to us and let us know.
So let's just reiterate that if you are homebound and you have not been vaccinated, then the county will send someone for free to your home and administer that vaccine.
Absolutely. It will be one of our nurses. Happy to come, accommodate in any way that we can, and get you vaccinated as quick as we can.
Dr. Ryan, all this information regarding the sites and the times and all the availability, that's also included on the Clear Creek County.us website. And why don't you give that phone number one more time?
Absolutely, yes. So all that information is on our website. It's also on our Facebook page. But the number is 303-670-7528.
Okay, we've been talking for quite a while, but there is one subject that's near and dear to my heart. I've just got to ask you one more time about this. I first brought this up way back in January. It was totally premature at the time. I was just thinking in advance. But now I think it's time to be seriously considering some form of vaccine passport. I'm wondering what you think about that, that folks who are vaccinated should maybe have a freer reign to the public sphere than folks that are not.
Yeah. So, Mark, one thing that we have done, actually starting last week, in sort of in the same realm, is for county employees, for instance, who are fully vaccinated, their passport is their CDC card and or the record of vaccination. What that allows them to do, it allows them the freedom when they're at work to choose to not be masked because they are fully vaccinated. So right now, that's as close as the county is going to get in terms of a quote-unquote passport. It's sort of differentiating between the vaccinated and unvaccinated. Why do I think it's important? Because they pose very different risks, not only to themselves, but to others and to the broader community. One will perpetuate the virus spreading and the pandemic as it is, and the other has made an effort to help curtail it. And so it's important to understand the risk potential that each of us poses. In the schools, similarly, staff are going to need to show their vaccine status to their supervisor. Many have asked, both businesses, private citizens, et cetera, have asked, is that legal? 100% legal. What is not legal is for me to tell the world that Mark Cuccinella is vaccinated, right? I don't know if you're vaccinated or not, but that's not legal for me to share that information unless I have your full consent and approval to do so. It is fully legal for an employer to ask employees if, in fact, they are vaccinated and to show proof of vaccination. The reason it's legal is because their vaccination status plays a significant role in the operations of a business. For instance, if all of my staff are unvaccinated, it poses a huge risk, not only to myself, but to my business. Because if they get sick and suddenly all my staff are unvaccinated and have COVID, and now I have no employees, my business is at risk. So I have a legal right to ask that. Just like schools have a legal right to mandate vaccinations among students for measles, mumps, rubella, the list goes on and on. There's a reason for that. We're trying to protect the schools and the students who are in the schools as much as humanly possible. So there's a legal precedent for that. You have the legal right to refuse to answer that question, but I think what it's quite clear is it tells your employer that you're not vaccinated. I haven't met anyone to date yet who is vaccinated who isn't happy as a clam to share that information with you. they're proud of it, and they want to make sure that everybody knows. So you have a legal right as an employer to ask and require that sort of information to be provided to you. You don't have the right to share it with others who don't need to know based on that model that I just described. That is a HIPAA violation. It is not a HIPAA violation to ask for it, nor is it a HIPAA violation to receive it as an employer and or county and or state and or government to require those sorts of things. But obviously those are not my wheelhouse. I'm neither in the federal nor state government, so I can't speak to that in terms of what they are planning or not planning to do. I don't know.
Well, I think it's going to depend on the trajectory of the Delta variant and the caseloads and all the rest of that. I will say this, Dr. Ryan, on a personal level. Yes, of course, I'm vaccinated, and I recently went overseas, and in order to do so, I was required to show my vaccination status. And in order to get on the plane to go overseas, I had to have a negative COVID test within 48 hours of departure. And on the way over, everyone on the plane was required to wear a mask. I have not felt that safe in public, I don't know, since let's say since before COVID. That it was such a comfortable experience, and I can't wait until the day when we can all feel that same level of comfort.
Mark, I could not agree more. I want this to end as much as anyone in this entire country. I want us to not be able to wear masks as much as anyone in this country, but I have to deal with reality. And the reality is we are dealing now with a variant that is far different than the original virus. We're dealing with 50% of the population who's unvaccinated and providing continued opportunity for the virus to continue to mutate and create new variants, potentially even more problematic variants. That's the reality I have to deal with. And so I have to make the best recommendations based on my professional experience and education as I can to help prevent all of that from happening. And I know it's difficult for any one individual to see the much bigger picture, right? We typically, as humans, don't take into consideration the much bigger picture when we decide things for ourselves. We're deciding for our own self. I don't have that luxury. I have to think of the biggest picture possible and help and do everything I can to prevent the worst from happening that I know can happen. It's not a matter of if, as I've said, it's a matter of when. You will get COVID if you're unvaccinated. I'm trying to minimize the number of those folks as much as I humanly possibly can and convince them of the importance of doing this, that it is not only important for themselves, but more importantly, it's important for the broader community and our society at large. Everyone's clamoring, open society, open the economy. Well, guess what? Those things don't get to open until we have this under control in full swing. We're seeing now when they're open prematurely and what happens when you have two worlds collide, the desire to open an economy and the lack of desire to get vaccinated. We're seeing that now in spades. In order to correct course, in order to achieve the goal that everybody has stated they want, we need more people to get vaccinated to achieve that reality. We can wish things to happen and we can dream about things to happen, but until everyone steps up and does what we all need to do, we're not going to get there.
All right, Dr. Ryan. Well, thank you for the update, and I know you have a busy schedule, and you've got things to do right now, probably a half an hour ago. But thank you so much for joining us, and we'll be in touch and see if we can get you on the schedule sometime again soon so that we can have another update.
Thanks, Mark. Happy to talk anytime. Be well and be safe.
Thank you. Bye.